Evidence-based practices are interventions that research has proven to show positive outcomes for people with autism. As of right now, there are 28 proven interventions that have been identified as evidence-based according to the National Clearinghouse on Autism Evidence and Practice. High-leverage practices are practices that should improve student achievement and are able to be used across all different content areas and grade levels. They are backed by research. These practices are divided into 4 categories of collaboration, assessment, social, emotional, and behavioral support, and instruction. These are important because they guide teachers on effective ways to teach content and hidden curriculum to students. They are research-backed with a lot of evidence to prove that they are effective. One example of how to use EBPs and HLPs for high-incidence disabilities is if a student has some social-emotional needs and hasn't quite learned how to act in a school setting. Perhaps the student wanders around the room during instruction rather than sitting in a seat. We would use the HLP-9 Teach Social Behavior, but we could also support this by using the evidence-based practices of using visual supports and reinforcements. Another example could be if a student is not performing well in math. The class is learning borrowing and subtraction, but the student is struggling to understand each step of the borrowing process. We could use the EBP task analysis to break the subtraction problem apart and master each step before expecting the student to complete the entire process in one go. One example of how to use EBPs and HLPs for low incidence disabilities is if a student has level 3 autism and displays self-injurious behaviors, we could conduct a functional behavior assessment to find the underlying purpose for the behaviors that are occurring. Conducting an FBA is not only an EBP, but also an HLP as well. Another example for low incidence disabilities could be for students who have severe communication needs. We could use an AAC device to aid their communication skills, which is considered an evidence-based practice. A high-leverage practice may be preferred over evidence-based practices when an intervention requires collaboration with families or other educators. Collaboration is a category of high-leverage practices. For example, a student may begin showing new behaviors that we have never seen before, and the teacher reaches out to the parents to see if anything has changed at home that might be the root of these new behaviors. On the other hand, an evidence-based practice may be preferred when a more intense behavior arises and the family has communicated that nothing has changed at home, but they have also noticed a change in behavior. At this point, we may have to begin EBP interventions such as extinction or naturalistic intervention. Another time an EBP may be preferred is when all HLPs have been exhausted in teaching a new academic skill and the student is still struggling. In this case, it might be beneficial to intervene with discrete trial training. It is important to use EBPs and HLPs in your teaching experience because they're backed by evidence and they are proven to show improvements in students.